Welcome to what is our fourth installment of our update to the incredible community that we serve here at Northern Westchester Hospital here in Mount Kisco. My name is Derek Anderson. I am the executive director of the hospital. And today I'm joined with a few very special people for us who we're excited to introduce you to. First, to kind of my left to the screen is Dr. Carl Reimers, who is the director of the Cardiac Catheterization Lab of the C. Mabosky Heart Center here at Northern Westchester Hospital. And his co-director, Dr. Garvey Rene of CareMount Medical, both of whom are cardiologists. We're excited to have them. They'll introduce themselves a little more in just a few minutes as we have an exciting announcement for you around the opening of our heart center in September. Also joining us is Cathy Manley-Cullen. Cathy is our Chief Nursing Officer here at Northern Westchester Hospital. So thank you to the three of you for joining us today for this update. We would like to start with just giving everyone a status of how we're doing related to COVID here at Northern and in our community. Give you a couple of statistics. So as of about 15 minutes ago, the hospital has, as many of you may be aware, dramatically dropped in the number of COVID cases that we're actively treating that are positive here in the hospital. We're down to about 5 patients who are testing positive for COVID. Some of you may recall that number was close to 100 at one point. Always a moving target as patients heal and move on in their care. And so always just a snapshot in time, but as of the snapshot this afternoon, we've only got about 5 COVID patients. Everything we're doing here at Northern Westchester for the past several months, in addition to keeping those COVID patients safe, is keeping clear separation and clear safety protocols for all of our patients who are non-COVID. And the good news for the community is overwhelmingly, we are almost entirely non-COVID here at Northern Westchester. And we've seen that trend across the state that you've been seeing in the media. And certainly we're seeing that trend locally here in Mount Kisco. So the numbers are looking extremely good. Every day we're admitting and discharging 1, maybe 2. And so that number is not fluctuating a lot, but we're still hovering at that 5 or so. And we're anticipating that perhaps for a very long time, we may not ever get to completely 0, but for now, we believe we're about as low as possible. And every day we continue to see good movement with patients recovering. To date, we have recovered over 300 patients who have been discharged from the hospital. We've tested over 2,000 patients that have come either through our ER, some of our ambulatory centers associated with the hospital that ended up going home and recovering from COVID. So all in all, we're talking about a couple of thousand persons who have been with us through the COVID experience. And as we move forward as a community and as the economy looks through the phasing plan that the state has laid out to reopen, of course, we're following that, and we're doing everything possible to make sure that every part of the care delivered at Northern Westchester is safe, it is completely sterile and separate from any potential risk of exposure to those who are unfortunately still battling this disease. A question that really we'd like to put out there is, what is the hospital doing around planning for a surge or planning for a resurgence that may or may not occur in the fall? And certainly we acknowledge what's been happening locally with our colleagues in Chappaqua with a small outbreak that occurred there. We're seeing what's happening across the country, particularly in Texas and Florida, Arizona, some of these states that have seen pretty dramatic rise in cases. And the challenge, of course, for New York, for us, is going to be how do those cases remain isolated and within those states so that we don't create a widespread outbreak here in New York. But should something occur, or should there be some correlation with flu as we normally see during the flu season in the fall, going into the winter months. A lot of work that we've learned from our COVID experience here at Northern that we're accelerating and translating into additional preparations. We have spoken to you in the past about our field hospital. The field hospital, which if you've driven past us here in Mount Kisco, is open. It is not treating patients, but it is ready to go should the need arise. And we will be leaving the tent up and ready on demand should something occur in the fall. And so the tent is not going to be coming down for the foreseeable future. And for that, we hope that that acts as a beacon of a safety net for us. We hope to not have to get to that point, but it is vital to some of our preparations. A few additional things that we've been doing. Cathy is going to mention a specific initiative that we've created here at Northern, one of two programs within the Northwell Health System. So 2 hospitals of 23 are now kind of destination sites, us here at Northern being one of them, for acute respiratory recovery unit, which are patients who are seeing an extended stay related to being on a ventilator. And we've created a specialized unit to help patients in their journey. And Cathy is going to mention that in just a few minutes. We spoke about the tent. We are also building and creating additional negative pressure rooms. So you may recall this through the pandemic, that having isolated rooms, and we're greatly benefited here at Northern that all of our rooms are private as a baseline. We are taking groups of rooms and adding negative pressure for further isolation and better ventilation. So that is a big investment that we're making, and a lot of those preparations investments will be done by the end of September. We are adding dialysis capability, which was something that emerged out of COVID, additional patients needing dialysis. We're doing a number of other facility infrastructure enhancements to prepare. A lot of work going on around planning stockpile of PPE. Our goal shortly is to get up to a 3-month supply, which we're almost at, for most of the vital PPE needed for our teams. And that, as you may recall, was really something that we focused on and emphasized a lot to protect our patients, but as well as the team members that are on the front lines of this. And so that is clearly a commitment that we're keeping and even further energizing for the fall. ICU surge planning. We have now identified additional ICU areas within the hospital should the need arise. And then recently we are over hiring in critical roles like nursing, respiratory therapists, and other roles within the hospital to prepare for any staffing demands that should the need arise. And that's to make sure that we're providing safe, appropriate care with the right ratios for every patient, COVID or not. So a lot of activity going on around planning for the fall. Again, we hope that we don't have to really activate most of this, but please take some reassurance that as your community hospital, we're doing everything we can to prepare. And where possible, diverting resources to make sure we're investing properly. Lastly, I just want to mention before I let Cathy speak to a couple of initiatives, I do want to mention that if you're joining us via Zoom, you can use the chat feature to ask questions. As soon as we hear a little bit from Cathy and then also from Dr. Reimers and Dr. Rene, we are going to open it up to questions. So please start sending us questions so that as soon as we're ready to jump right in. And that also includes those joining us on Facebook. You can post questions on Facebook and that'll funnel to us. So the very last thing I want to mention is, during the pandemic and during the height of COVID, we were actively still treating emergency surgery, still actively delivering safely, many newborns coming in through our OB and maternity program. In fact, to date, through the end of June, we've delivered over 900 babies this year, and that's through the pandemic. And so, and again, for us, that's a celebration of, the juxtaposition of life and what we've been experiencing during COVID. And so that's just such a bright spot to know that excellent care is continuing to be delivered here at Northern, despite what you may or may not be reading in the media and around you. So there's incredible work happening, and Cathy's going to talk a little bit about surgery. That has been a focus of ours to make sure that we're providing access to care quickly and promptly so that really nothing is delayed from a surgical standpoint. So with that, please start filtering questions for us. And Cathy, do you want to go ahead and maybe share a little bit more about a few of these initiatives? Cathy, let's just go ahead and have you unmute. So while Cathy's unmuting, I do want to mention just one other brief topic, which is we've seen what's recently occurred in Chappaqua. I think it's clear that spikes in COVID cases will continue to occur. And despite us seeing only that 1 or 2 cases a day and then a patient going home, that kind of little fluctuation, it's not going to be a surprise in our communities if we start to see little flare-ups like what we've been witnessing. And so I don't know if that's necessarily a huge alarm, other than as a hospital, our message is continuing to be for you that we need to follow social distancing practices and do everything we can to follow the mask protocols and everything that the state is doing. So with that, Cathy, do you want to go ahead?
Thank you. Okay, got past the tech issues there. So good afternoon, everyone. I'm thrilled to be here. I arrived at Northern Westchester Hospital in mid-December, so certainly new to Northern Westchester, but not new to this community. I live with my family in Pleasantville, and I'm thrilled to be here at Northern Westchester. I come to you by way of a large academic center in New York, Manhattan, and Brooklyn, and I've worked in a lot of different facilities, including some here in Westchester. My clinical background is emergency nursing, critical care, transplant, and air and ground transport. And so I am really thrilled to be here to lead this incredible team of nursing professionals here. I've found them to be clinically competent, caring, compassionate. I mean, you should all be very proud, as I am, of all of our clinical team that we have here at Northern Westchester. And as Derek stated, we have been preparing for a resurgence in COVID. We've worked through COVID. The team has shown up. We are we supported them. We're making sure that there's lots of wellness activities for them. We feel like our team is all in a great place. And given that, we are now preparing again for any potential resurgence, whether it would be COVID, flu, or any other potential infection. And so one of the things, Derek mentioned a few things, but one of the things that we're very proud of right now is we put together this unit here at Northern Westchester, this acute respiratory unit, one of 2 within the system. And we are taking patients from here in the hospital, in the community, or in other hospitals throughout the system that have very special needs post-COVID. So these are patients that were on ventilators or respirators. They may have had a lot of needs in terms of physical therapy, healing of wounds, and we've brought them here to the specialized unit, and we've so far been able to discharge quite a few of these patients from the hospital. It's always a great celebration because they spent such a long time in the hospital, either elsewhere or here. And that particular unit, in addition to having specialized staff that is really focusing on all their needs, we've done a lot of infrastructure things. In addition to having, monitoring, like physiological, cardiac monitoring. We put in video monitoring so we can have eyes on these patients all the time. A lot of technology things that we've utilized here in order to better care for this patient population. We have a much more staff on that unit, whether it's respiratory therapists, physical therapists, occupational therapists, a real team approach to that unit. So again, very exciting here at Northern Westchester. We also have been working very diligently on surgical services, and we had, as most hospitals had, quite a backlog of patients waiting to have surgery, as no one was doing surgery during the whole pandemic. So we have been very efficiently bringing back those patients that were waiting for surgery. We've gotten through a great part of our list. We're continuing to do new surgeries here, and we're making sure that it is the safest environment for patients to have surgery. Patients come prior to the surgery, they have COVID testing to make sure that they aren't positive for COVID. We are using a lot of new technology in terms of cleaning in the operating room. Our team every day that comes to work throughout the whole hospital comes in screened for signs and symptoms of infection. We have mounted cameras that are taking staff's temperatures to make sure that no one has a fever. We have plenty of PPE, personal protective equipment. We were very early adopters here at Northern Westchester of masks. All of our staff wear masks while in the building, and goggles, whatever PPE is appropriate for the type of patients that they're taking care of. And one of the things that has happened since post-COVID is that all of our employees, team members, have been tested, their antibodies tested to see if they have been exposed to COVID. And we have a lower rate of exposure here in the hospital than the overall community. And what that tells us is that everything that we've put in place, our personal protective equipment and clothing that we're wearing every day, is working. So really good hand washing techniques, wearing those masks, keeping them on all the time. Our staff are staying safe, and so are our patients. But to take it back to the surgical services, again, we are screening patients, we're screening staff, we're doing a lot of that really deep cleaning, and so we believe that we are really safely providing surgical services now here at Northern Westchester. Just a little bit about our emergency department too. Emergency departments across the state have seen their census or the volume drop. People weren't coming to the emergency department. We've started to see that volume pick up again here at Northern Westchester. And I want everyone to know that our emergency department is an incredibly safe place to come if you need to come to an emergency department. Patients are greeted at the door. Are screened, we immediately give them masks, and they're immediately brought to one of our 26 private rooms. So there's no waiting in a waiting room. Patients are brought right in and put in their private rooms. We have an incredibly competent emergency department staff that is well-versed in caring for our patients and the community. And visitors that are allowed to come, one visitor with patients in the emergency department, and they go with the patient right into their room. So again, if you need me, we're the place to come. As far as testing goes, just a little bit about testing. Back in March when COVID first struck, testing was pretty limited, but we are not having any issues with testing right now. Testing is available. And in fact, we are doing antibody testing for the community, and that's available at our Center for Healthy Living down at Chappaqua Crossing next to Whole Foods, should anyone be interested in availing themselves to that. So again, wearing masks, social distancing, whether you're outside or you're in the building, is really important. We are, again, as we are fully operational and available to care for patients, we are extremely excited about a new service that we are bringing here to Northern Westchester. So I'm happy to announce the Seema Boesky Heart Center at Northern Westchester Hospital that is available to us by virtue of a very generous donation. And so at this time, it's my pleasure to introduce to you Dr. Reimers, who will be our director of the Cardiac Catheterization Lab, and Dr. Garvey Rene, our associate director. So, gentlemen.
Greetings. I'm Dr. Carl Reimers, the director of the new Cardiac Catheterization Lab of the Seema Boesky Heart Center here at Northern Westchester Hospital. Derek, do you have a picture that we can show of this lab? This is a brand new state-of-the-art cath lab that is scheduled to open on September 2nd. And it will be a 24/7 lab, open 365 days a year. This is, again, beautiful, absolutely gorgeous, state-of-the-art lab. And I know Dr. Rene and I are, very, very excited to be part of this. As a brief background of myself, I've been a practicing interventional cardiologist for 25 years, practicing at institutions solely in Manhattan. In 2004, I was recruited to Lenox Hill Hospital. I became the director of that cardiac catheterization lab in 2011 and was in that position until 2014 when I became the vice chairman of cardiology there. I've lived in Connecticut for 23 years and am very, very happy to be here in Mount Kisco. I've done my time in Manhattan, and this is a very exciting time for us. We want to talk a little bit about some of the advantages to having a cardiac cath lab here. But before that, I'd like Dr. Rene to introduce himself.
Hey everyone, thank you so much. I'm Dr. Garvey Rene. I'm currently an interventional cardiologist with CareMount Medical. As a lot of you already know, CareMount Medical, formerly known as the Mount Kisco Medical Group, is one of the biggest group, one of the main groups in Northern Westchester, has been in Northern Westchester for more than 50 years. I'm actually their first interventional cardiologist. I was recruited at CareMount in 2017. And I've been with them for about 3 years now, and it's been a pleasure to be in the community. Currently, I myself, I live in Goldens Bridge, so I recently moved there, so definitely part of the community there, and plan to be there for a very long time. Before I had joined CareMount, I was at the University of Pennsylvania, and before that as well, just like Dr. Reimers, I also trained at Columbia University Medical Center in Cornell before joining CareMount Medical. Since then, for the last 3 years, I've been taking care of many of, CareMount's patients, all the way spanning from Westchester all the way up to Dutchess County and Ulster County. So we have a very great presence there, and it's a blessing to have this cath lab that now will be able to provide state-of-the-art, amazing care, and also in a hospital where a lot of our patients really love and really appreciate that. So we're very happy that we'll be able to start to do these procedures that Dr. Reimers will talk to you a little bit more about, and we'll probably should be able to start that in September. Thank you. Go ahead.
One of the things that's been widely known is that this general area has been underserved for patients who have coronary artery disease, especially with the ones who have what we call acute coronary syndrome, which is patients who have new onset chest pain, but leading all the way up to patients who are acutely having heart attacks. Time is of the essence when patients start having heart attacks, and the history has been that when a patient starts having a heart attack in this general area, believe it or not, 65% of them are picked up by Westchester EMS and sent to Connecticut. And the other third end up going to Westchester Medical Center in Valhalla, which obviously creates some delay. We have numbers showing that quite a number of patients are being transferred out of state and down to Valhalla. And so this is a wonderful service that we're providing to this community. In addition, I can speak that I have so many patients who refer to me for elective cases, and they have to go all the way to Manhattan along with their families. And that's a journey. Even in the pre-COVID era, that was definitely a journey. So I think that this is something that these patients truly appreciate. We will take care of any and every emergency that comes into this hospital, cardiac emergency. When we do a more elective case, and we determine that it may be a slightly higher risk elective case, we will send those patients down to Lenox Hill, and we ourselves will perform those procedures. I would estimate that would be representative only 10% at most of our diagnostic cases. All of us, there are 4 of us, including Dr. Rene and myself. There will be Dr. Rashid and a Dr. Bassman. I trained both of those men. They're outstanding physicians. All of us will spend some time rotating down to Lenox Hill to keep that skill set up. That being said, all the urgent cases certainly will get done here. Dr. Rene, if you'd like to add.
So we're very happy that we'll be able to do all these emergent cases. But like Dr. Reimers mentioned, so there are a lot of patients, especially patients, they get a positive stress test, they see their cardiologist, and they want to have a cardiac catheterization. All those can be done. All those will be able to be done right now in Northern Westchester. There's no need to go to Lennox-Hill to get those done. There's no need to go to another hospital in Westchester to get those done. So, and again, so that definitely will be a plus in that sense. There are other patients, for instance, patients who need to have cardiac surgery. And before having cardiac surgery, they need to get, an angiogram of some sort just to get ready for the procedure. All these things will also be able to be done in our procedure suite in the cath lab. They'll be there as well. And even more, this will be a great way to establish a connection to not only Northern Westchester, but also to Lennox-Hill, that Dr. Reimers mentioned, for all the other complex procedures that we'll be able to do for them as well down there. Okay. Anything you want to add?
I think that in a nutshell sort of spells what the program will be. And, at this time, we're more than happy to entertain any questions.
Thank you, Dr. Reimers and Dr. Rene. I mean, clearly an exciting initiative, not only for the hospital, but for the community. We read that time is heart, just like time is brain when it comes to a stroke. And the quicker that our community can access high quality services from extremely well-trained professionals like yourself and the staff that will be supporting you, only brings more confidence that this is going to be an incredible program. So we're excited to have you both join the Northern Westchester Hospital family, the community family. Dr. Rene, you've been here already. I live in Goldens Bridge as well, so I'm kind of up in your neighborhood. So we're excited to kind of welcome both of you and this program as a whole. I don't know if we specifically mentioned it, but the plan is September is when this officially launches. And so just to reiterate that date and to let you know that you'll be hearing a lot about this in local communications and with our town supervisors, our local EMS community, to make sure that everybody's fully aware that this program is live. And please, because it can make a difference in a life, please come to Northern Westchester Hospital should you have any questions or concerns related to your heart. And again, we're excited to launch this program.
I wanted to add that, again, all these procedures that can be done very safely, the same precautions that we normally take for other surgical procedures, the same precautions also be taken. There will also be COVID testing prior to all these procedures being done, usually 40 to 72 hours. All the staff is also monitored. So all these procedures will always be done in a very safe manner. From the time the patient comes into the waiting area to the time the patient gets the procedure done, and even after discharge, all the same precautions that pertain to any surgical procedure will be done also for this cath lab.
Absolutely.
Excellent, thank you. And we appreciate both of you with the masks. We know that you're wearing the masks because you're physically in the same room, and that's certainly another standard here at Northern is anybody coming into the building needs to wear a mask to protect themselves as well as others from potential exposure. So thank you for the off and on of the mask. We appreciate it. So why don't we do this? I appreciate all three of you giving us additional information and context. We'd like to start to take a couple of questions. And the first one that we'd like to address, Laura on Facebook asked about maternity, especially during the summer months, and specifically if the NICU, our neonatal ICU, is fully functional. And Laura, the answer to that is yes, yes, and yes, all of the above. As we mentioned, our maternity program has been frankly busier than ever as we've seen record numbers decide to elect our maternity program. And especially our NICU is very functional and has been during the pandemic. In fact, we are making, as we speak, additional investments into our NICU program to grow additional capability around brain cooling of these infants in some situations and other subspecialty care within neonatal ICU. So Laura, thank you for the question. Cathy, is there anything additional you'd like to add around maternity or our NICU?
No, as you said, just that we've been incredibly busy. A lot of patients have decided to transfer their care to here at Northern Westchester. Our staff continue to take the best care. I feel like our programs that we have in place are good. And as it relates to NICU, we are continuing to be prepared to take care of higher acuity patients. So all good on that front.
Excellent. Thank you, Cathy. Dr. Reimers or Dr. Rene, there's a question on here that's asking, does someone have a choice in which hospital you're taken to if you call an ambulance? And how does that work?
That's an excellent question. And the short answer is that if you're indeed having a heart attack, they're going to take you to the closest hospital they can. Now, that being said, Westchester EMS clearly knows that this is the hospital to go to in this area because of the fact that you want to take your patients to a cath lab. So, as I said earlier, the reason that so many patients who are having heart attacks in this area have gone to Connecticut is they're being taken to hospitals, specifically in Stamford and Danbury, that have this capability. Because that's what you want. You want the capability to take them to the cardiac cath lab and make the definitive diagnosis and do the definitive interventional procedure to spare heart muscle. So, Westchester EMS actually went to bat for us when we were arguing our case to get, acceptance from the state, and they're very excited about this. So the short answer is a lot of times no, but the truth is that if you're in this general area, North Salem, Chappaqua, Mount Kisco, they're going to bring you here.
Excellent, thank you. And certainly for us, it's making sure that every encounter and every patient receives the same level and standard of care that you would anywhere in the world. And we can effectively kind of guarantee that with this program. You're getting world-class physicians and world-class nurses here locally. And for us, that's the root of it, is having high quality services in your backyard. So with that, just kind of pivoting just for a moment, there's a question around flu vaccinations in the fall. Should we assume that flu vaccines will be all the more necessary this fall? Somebody's asking us to address. So maybe I'll let one of our physicians address this. Should we be seeking flu vaccines?
The short answer is yes. So just because we have a new virus in COVID, and hopefully we'll have a vaccination for COVID beginning of 2021, that does in no way lessen the importance of being immunized for the influenza virus this fall, especially for higher risk groups. So, I think that if anything, I hope that this pandemic will make people realize that indeed immunizations are extraordinarily important. And so yes, please, when the flu vaccine comes out this fall, even if, for influenza, it is very important to do.
Excellent, thank you. And maybe just dovetailing on that same topic, there's another question around, is there a reason to expect a surge in the fall besides it being the same time as the flu? So Carl, I'll let you, it looks like you'll probably have a great answer for this. And then I have a part two that I'd like to show a graph once you're done.
Yeah, I think that obviously a second wave is of deep concern to all of us. We're seeing, unfortunately, the first wave really hitting the southern states. New York State really got heavily exposed before we truly understood that we needed to lock down. And therefore, New York State remains the state with the most infections, unfortunately the highest mortality. But the exposure rate in New York City is thought to be about 25%, which is about 4 or 5 times higher than the rest of the country. What I'm suggesting, and again, I'm not an epidemiologist, I'm not an infectious disease specialist, but what I'm suggesting is that it's my belief, and maybe Dr. Rene, you can give your 2 cents on this, that we are going to have spikes, as you've said, Derek, I don't believe, frankly, there's going to be a big second wave in this area because I think there's already been so much exposure. I think there is some level of herd immunity. Garvey, do you want to add anything to that?
Well, I do want to say that although like a spike is possible for sure. However, I am very encouraged by what I've seen in our community in New York, in the sense that people have been wearing masks, and we do know that masks are effective at reducing transmission. Okay, so when I do go to the store, to Chico's and everywhere, people are wearing masks, and they're very effective. And we do wear masks in our hospital. We do wear masks in our offices at CareMount. And for instance, when we were testing our patients, and we have tested our patients quite extensively in April, our rate of positivity was about 14%. And then now, as of late, and been doing a lot of testing as of late, less than 1% of the patients in the Northern Westchester community have tested positive. And I think that attributes it to a lot of the behaviors that people are still wearing masks. People know a little bit more about this disease. They are washing their hands. They're using the hand sanitizers. And I think as long as people can continue to maintain a lot of this behavior, we can pretty much reduce the chance of having another major spike. I think we're still going to see a few cases in there, but I don't think that it will be to the same extent that we saw it in March and April, as long as we're able to maintain the same behaviors that we know work and know reduce the possibility of COVID coming back with a full force.
Excellent. Thank you both. Kind of on this topic, and then I'm going to go ahead and share a graph, is Loretta had asked on the chat with the newest information, and it's precisely on this topic. There's new information being broadcast around the spread of COVID via aerosols, through talking and singing. Does this information change any of our decisions or how we're approaching it? And my thought is, and based on what you were just describing, Dr. Rene, with the mask and the obsession with hand washing and maintaining distance, this really shouldn't change our view. And I think we've known all along, certainly within the hospital and treating COVID patients, that the aerosolization of this disease is probably at its most risky state. And so anything further you want to add? I guess, is that a true statement that this really is not new information for the medical community? It may be new to media or to kind of national news, but any comments on this?
Well, I think that honestly, predominantly, we're looking at droplet spread. And when you say aerosolization, what you're implying is that the virus is literally on its own and not attached to like a droplet. That really occurs primarily in patients while they're being put on ventilators. And so, hence why we take extraordinary precautions, wearing N95 masks, face shields, and so forth, when we're around these very, very sick patients. I personally don't think that, I think that basic principles, let's keep it simple, social distancing, wear your mask, wash your hands. I think those are the cardinal things to remember. Keep it simple and we'll get through it. There will be an end to this, by the way.
I think we certainly all hope so. Excellent. So I'm going to go ahead and share this slide for just a quick moment. And just to orient everybody who's out there and listening, this was taken from a New York Times article about a month ago that showed essentially possible scenarios. And you see scenario one is this kind of initial spike in the spring, and then over the next 18 months, this kind of peaks and valleys of surges happening across the country. Scenario two is similar to what was experienced during the 1918 and 1919 pandemic of the flu, which is there was kind of this initial peak in the spring as we experienced, and then in the fall, there was a much larger peak. You can see that on scenario two. And then scenario three, and again, all these models are oversimplified. We acknowledge that, but this is kind of a collective base, and please reference this article. It's a fascinating projection on what may or may not come, but scenario three is that initial spike and then what they're calling a slow burn, which we're going to see little peaks and valleys, but nothing substantial. I think it's our collective hope that nothing really substantially comes of this, but that's really going to rely on the entire community and the hospital and all of our providers being obsessed about hand washing and social distancing and keeping to, as Carl or Dr. Reimers said, the basics of stopping this spread. And I think with
Eric,
that diligence, yeah.
could I just add something? So I think that those scenarios are all certainly possible, but I think it depends on the area of the country you live in. And the one thing the pandemic of 1918 showed us is the cities that got hit the hardest first tended to not have the second waves. The ones that got hit not so hard the first time tend to have second waves and third waves. In this area, in New York State, I believe that we're looking at scenario 3, where there's the initial really big peak and then little tiny spikes down the way. I certainly don't believe that we're going to see scenario 2 at all in this area.
In our immediate area. Excellent. Great. So let's just shift gears just a moment. There's a question from Amy on, are we doing general swab testing for everyone, including COVID testing for everyone? And Cathy, maybe I'll ask you to address this. Amy does make the comment that she was surprised our hospital was not listed on the COVID website for a place to get tested. I think certainly that's something for us to look into. And maybe Amy, if you can message me specifically what COVID website you're referring to, we'd be happy to investigate. But Cathy, can you just talk generally? It's always a question out there. What are we doing currently around testing? Are we testing anybody? And you mentioned Center for Healthy Living. Can you just give more info on that?
Sure. So we are testing here in the hospital. All patients that are admitted get tested. We test patients that are coming in for surgery, for chemotherapy, various different outpatient procedures. In addition to that, our Center for Healthy Living down at Chappaqua Crossing next to Whole Foods is doing testing. A lot of patients that are coming in before procedures are going there, but we have COVID testing. We have antibody testing available as well for the community at that site.
Excellent. Thank you, Cathy.
Mm-hmm.
Sandy just asked the question, Dr. Reimers and Dr. Rene, is the Heart Center here at the Seema Boesky Heart Center here at Northern planning to do procedures such as pacemakers and other electrophysiology-based procedures? And if so, what is your time frame for that?
That's an excellent question. The short answer is this hospital is already doing permanent pacemakers and temporary pacemakers. We are starting an electrophysiology program, and currently our staff is techs and nurses are being trained to do electrophysiology cases. We're in the midst of finding the right doctors. I think the plan is to get the cardiac cath lab up and running as of September 2nd for coronary cases, with electrophysiology to follow maybe a couple months after that. I am not sure exactly when it's going to start, but the electrophysiology cases that are done here will involve right-sided ablations and all diagnostic procedures. The left-sided ablations, which carry a little bit more higher risk, would be done down at Lenox Hill Hospital.
Excellent, thank you. Let's jump back to COVID. There was a question on clinical trials happening here at Northern and at Northwell, and what's the current state of those. We don't have a visual on this, but I'm gonna quickly just run through the 3 primary clinical trials happening here. And then if I may segue that into clinical trials happening within cardiac that will be introduced with us, Dr. Reimers, if maybe you can in a moment speak to some of this, because bringing additional access to clinical trials in all of our programs only helps sophisticate the care and raise the level of care that is available to our community. So, but let me go back to COVID. We've mentioned this on a few previous calls. We are still actively in the Odyssey trial, which is a randomized controlled clinical trial. We're in a matched randomized trial for hydroxychloroquine. And that was the one that had the 3 arms, that was whether placebo or combination of placebo and hydroxychloroquine. So we are still actively in the match trial, as well as we're offering convalescent plasma, and we've expanded access to that program. So those are the 3 active clinical trials. We do have access to remdesivir here. As you may have read, it is being pretty strictly organized and delivered through even kind of the federal government. So we have allocations here for use for patients if needed of remdesivir. So we have access to that as well. Beyond that, Dr. Reimers, can you speak to some of our clinical trials happening that we'll be introducing here in cardiac?
Certainly. So Northwell has a very, very active research center called the Feinstein Institute. I've known Dr. Christina Brennan, who has been pivotal in running this, especially in terms of cardiology trials. Most of the cardiology trials are pharmaceutical trials, often related to how patients are treated during or post myocardial infarction, but also in terms of newer anticoagulation protocols after stents. We're always trying to shorten the length that patients require anticoagulation after having coronary stents. And there are other nutritional trials. Once we have the lab again up and running, we certainly will be launching research. I would expect probably by October. I have already been in contact with Dr. Brennan about this, as well as there is a dedicated research coordinator for Northwell who is here, who I've met with several times. So that'll get launched very quickly, and we will definitely make known the specific trials as they come online here at Northern Westchester Hospital.
Great, excellent. And it's probably worth noting that we have a number of clinical trials that we probably don't have enough time to get into because there are so many happening within our cancer center here. And so there's a number that are happening every day here at Northern within cancer care. Just again, let's switch gears. Just the nature of the questions is somebody's asking, have the school districts reached out to the hospital seeking guidance for reopening of school districts? So the short answer is no. But we are actively, we do meet with our, what's called the President's Council. It's a leadership group that I convene every other month, and we've been even connecting over Zoom during the pandemic of a number of our town supervisors, most of our town supervisors in kind of the 11 immediate towns that we serve here, as well as school superintendents. And that group is very active. We keep them updated on everything, access to care, testing, capability of the hospital. And certainly this topic has been on those discussions. And so while not directly guiding that, and a lot of that is coming from the state Department of Education, but certainly we are staying in very close contact with our local leaders as a hospital. So with that, the infection, so TM on the chat has asked the question, the infection rate is increasing dramatically across the country, but the death rate seems to remain flat. What would we attribute that to?
Well, it's hard to know exactly what is happening as to why the death rate is still quite flat. But one, I do think we do know a little bit better in terms of how, to treat this disease. Of course, there's been multiple trials. We've seen some positive news with the dexamethasone. There's some conflicting results with the hydroxychloroquine, but they say possibly could work a little bit better. But we do know a little bit more in terms of how to treat this. So I think that may be what's being reflected now in terms of why we're seeing possibly lower death rates. But I wouldn't say that we know exactly yet what things are going to do in the next few weeks because we're still fairly early on in the peak of the infections, and we know a lot of these patients, if things happen, it happens 2 or 3 weeks later. So I don't know yet exactly. I don't think we can formulate as to what the specific reason why we're seeing this happening. But the one thing I can say is that we do know how to treat this a little bit better. There's still a lot of questions that remain to be answered. And we still have to wait to see how things are going to pan out over the next few weeks.
I agree with that completely, and I would just add that it appears that the demographic currently in the southern states is slightly different. It appears that there's a younger population that is spreading this infection. We know that younger people don't always do well, but in general do better than those over 65. So that may be part of it, but I think as Dr. Rene said, we have to have a lot of caution because this new surge, down south, which again is their first wave, it's still a little early to know what's going to happen to the death rate.
Yeah. And if you look technically as to what happened in New York, about half of the deaths that experienced in New York were technically in nursing home patients. So again, like Dr. Reimers mentioned, if half of the patients are nursing home patients, so that's at baseline a higher risk population. So if you're not seeing the same number of nursing home patients, maybe that's why you might see a lower death rate in that sense. But again, the disease is very interesting. Still, there are a lot we don't know about this disease. So I wouldn't say that it's a much, much lower death rate now. We still need to see how things pan out in that sense.
Excellent. Thank you both. So Vivian on Facebook has asked the question, is cardiac rehab, our program at Chappaqua Crossing, open and has reopened after COVID? And Vivian, the answer to that is yes. It has been open for a couple of weeks. You will notice a change. There is a spacing of appointments. The physical space, there's right now about 12 feet that we're kind of keeping around each patient while they're going through their treatment. So you will notice some changes, just as we're doing here at the hospital upon initial check-in, asking or screening for any symptoms or signs of COVID, asking to wear a mask. So you'll see a few changes, but we are actively running the cardiac rehab program, and it has been up and running for a couple of weeks. So thank you for that question. So we're just about out of time. And I wish we can get to a lot of these questions. I appreciate some of the questions that were sent directly to me, and I will get back to those individuals via email and via here. So thank you for everyone who's been joining us today. I just want to emphasize a couple of quick things. Number one, please continue to do as you've been doing and helping us stop the spread of this disease by doing what Dr. Rene is doing right at this very moment, which is putting hand sanitizer on. Unless Dr. Rene, that's hand lotion. Let's pretend that it's
sanitizer.
It's hand sanitizer. So continue to practice good hygiene, good social distancing, so that we can prevent and hopefully meet that there is no spike into the fall. But please stay diligent. I am going to share my screen because there's always ways for you to connect with us. And so if you give me just a moment. Go ahead and share this. There's always ways to connect with us on Northern Westchester Hospital. If you have questions that were not answered today, it's difficult to try and answer every question. And certainly there's still a lot that's unknown about this, but I want to thank our panelists today, Dr. Carl Reimers, the director of our cardiac catheterization lab, Dr. Garvey Rene of CareMount Medical, his associate director. We appreciate both of you for being here and taking the time to talk to us about what is an exciting launch of our Seema Boesky Heart Center here at Northern Westchester that's opening in September. So thank you both very much. And Cathy, as always, thank you for being with us as the chief nurse of this hospital and leading a lot of the teams that have been on the front lines of this pandemic. So we want to thank everyone again for joining us today. Please connect with us via social media. Stay engaged. If there's anything we can do to support or answer, this hospital is here and will always be here for you as a community. So thank you.
Thank you.
Thank you.
All right, be well.